Assalamualaikum. In this video, I am discussing recall communications. The task is that talk about glycopyrolate for a drooling CP patient. So glycopyrolate we talk. So as usual, we start with IRCAP. Mother is asking, why does my child have hypersalivations? So hypersalivation or excessive drooling is common in childhood with cerebral palsy due to their difficulties in controlling the muscle around the mouth throat. This can lead to an inability to swallow saliva effectively, causing it to accumulate and spill out of the mouth. So why is hypersalivation, if mother asks? So it is a very common problem, hypersalivation, excessive salivation and drooling in a CP child, because the muscles around the mouth and throat, they have the inability to swallow, spill. That's why the muscles has problem around the mouth and throat. Okay, mother, what are the alternative if glycopyrolate does not work or has too many side effects? So the alternatives include of the glycopyrolate are, first of all, botulinum toxin injections. Botulinum toxin injection, these are effective and have fewer systemic side effects but need to be repeated every few months. Number 2, medications such as scopolamine patches. Number 3, behavioral interventions. Behavioral intervention is like continuous effort in the speech and occupational therapist, which help to make him muscle strong, and we can use it with medication as well. Surgical option is that as a last resort for severe cases, but still using this medication is better as starting way, and we can use the other alternative in case it's not working well. So we tell that glycopyrolate we are giving. Other alternative are like botulinum injection, we can tell, medication scopolamine, speech and language therapist, and surgery we can tell. If glycopyrolate not working, then we can think about this. Then mother asking, how long would be my child need to be on glycopyrolate? The duration of the treatment can vary. Some children may only need it temporarily until they improve their muscle control and therapy, while others may require long-term treatment. Regular follow-up is necessary to assess the effectiveness and adjust the treatment as needed. So mother asking how long take the glycopyrolate, I will tell that it actually varies. Some has needed small time, some has needed long times, because when he taking the other therapy, how effective, and also you need to follow regularly because it is working properly and adjusting the dose. Then mother asking, how after would my child need to take glycopyrolate and what form? So glycopyrolate is usually given 2 to 3 times a day. The exact dose and frequency would be tailored to your child's need and response to the medication. So it is 2 to 3 times daily the dose is, and adjust dose and frequency would tailor to your child and need and response the medication. The medication response is telling. Mother, is there an interaction with the anti-epileptic medication like lamotrigine? So glycopyrolate has any interaction with the lamotrigine? Generally, glycopyrolate does not have any significant interaction with the lamotrigine or other anti-epileptic medications. However, monitoring is essential to ensure there are no adverse effects or change in seizure control, especially that he has received other medication which must be revised before starting it. So normally there is no interaction between the lamotrigine or other anti-epileptic medication with the glycopyrolate. But before we start the treatment of the glycopyrolate, we have to drug level we need to check. So how does glycopyrolate work? So how mechanism of actions? The glycopyrolate is a medication that works by blocking the action of the acetylcholine, which is a chemical that stimulates the gland. This will reduce the production of the saliva and decrease the drooling. So glycopyrolate, how it act by blocking the acetylcholine. Acetylcholine is a chemical substance which is stimulate the gland to secrete the saliva. So it will block the acetylcholine secretions, which will reduce the production of the saliva. Okay, so it acts on the acetylcholine. Okay, mother, are there any side effects of the glycopyrolate? Yes, glycopyrolate can have side effects, but we are weighing benefit and the risk. Common are include dry mouth, constipation, difficulty pee. In some cases, it not in all, that especially if used at higher dose, and we will monitor about that. So what are the side effects of the glycopyrolate? That is like constipations, like pee, reduce the amount of pee, dry mouth, constipation, difficulty pee. Again, dry mouth, difficulty in pee and constipations. But it will be if higher dose we are giving. We will monitor his condition, benefit versus risk we need to do. Then mother asking, is it ethical to start my child on glycopyrolate? Yes, it is ethical to use glycopyrolate provided it is done with your informed consent and under careful medical supervisions. The goal is to improve your child's quality of life by managing the drooling, which can a lot of problems as choking, discomfort, and social embarrassment. So mother asking, there is a glycopyrolate. So yes, it is ethical to use glycopyrolate provided it is done with your informed consent and under careful medication supervision. So we are giving glycopyrolate ethically with consent of the mother under medical supervisions, because why we are giving it is improving the quality of life. Otherwise, the child is suffering continuously choking, aspirations, and also social embarrassment. That's why we are giving. Then hyacinth patch versus glycopyrolate. We need to talk about this matter with the consultant, hyacinth patch and glycopyrolate, that is. So this is all about CP child, why we want to give glycopyrolate communication. Thank you.